Why is money talk so hush-hush in the home health space? That's something we need to change, and I'm going to change that in this episode. It's important for the public to know how money moves in the home health world and how that can affect you if you want to be a home health worker, or how it can affect you or your loved one if you are receiving home health services. You may not realize it, but you may have seen or know of someone who needs or is receiving home health services. But yet, it's amazing how this service is so underutilized and under talked about in media and just in general in everyday conversation. Well, we are going to change that today and always with this podcast. Let's get into the episode. Hello everyone, welcome back to my podcast / YouTube channel. If you haven't watched or listened to my previous episodes, I am Dr. Franny and I am here to talk about everything matchHHa, which is an app that I created. I'm here to talk everything home health, everything healthcare worker, and everything health and wellness. I am co-founder and CEO of matchHHa. If you don't already know, matchHHa, which separated is matchHHa, is a mobile app that makes things way more convenient in the home health space. If a patient or family member needs a nurse or caregiver, all they have to do is open the app and see who matches their schedule and who is in their area. Also, we have a groundbreaking and innovative healthcare worker incentive program that we would love you healthcare workers to be a part of. If you'd like to know more, feel free to DM me on any of my social media platforms linked below, or just download and register on the app. Now, we always want to remind people that the app is in our beta stage, which means it is definitely not the final, most complete version. Apps, when starting out, always launch a beta version so that users can use as much as possible and give us feedback whenever you can, so we can make sure we are giving you the best value. So feel free to reach out to us at matchHHa.com or just register on the app and we will get in contact with you. Okay, so my question for you all is, do you know how home health works? Or better yet, know how money works in the home health world? As I mentioned earlier, the issue is money is barely talked about in home health unless you are in the billing department and you handle claims and eligibility and all of that. But based on my experience talking with nurses and caregivers in the home health and home care world, it's rare when I see that healthcare workers actually know how the funding is provided for them to be able to provide the service that they are actually giving to the client or patient. One of the main ways home health and home care agencies are funded is through reimbursement after the service is provided. So if a nurse or a caregiver goes to a family's home and works for, let's say, an 8-hour shift, they report those hours to their agency. Then the agency reports those hours either to a government program like Medi-Cal or Medicare, or to a private insurance company like Humana or Blue Shield. So now the government program or insurance company now determines how much they are going to reimburse the agency for sending the caregiver to the family's home. Based on the reimbursement rate that the government or insurance company gives the agency, that determines what they will pay the healthcare worker so that they can continue to run effectively. So here's where things are getting kind of crazy in the home health world. If, let's say, a government program decides not to give you a good reimbursement rate, or even worse, like what Medicare is about to do, if they cut your funding to give you even less, how can agencies have enough to pay their healthcare workers in order for them to sustain themselves? Just a question that we all have to ask ourselves. In order for these reimbursement rates to be more reasonable, agencies often have to fight through legislation, which on top of every other thing agencies have to keep up with, like state regulations, managing their staff, etc. When you add on fighting for fair reimbursement rates, you can imagine why it may be difficult for these agencies to stay afloat. When looking at the national hourly pay for LVNs, which is about 24 per hour, CHHAs, which is 15 an hour, and personal caregivers, which is about 15 an hour also, you can't really blame workers for also advocating for themselves and wanting more. With all the inflation going on, everything is overpriced. The cost of living is just, craziness. So naturally, home health workers want more pay. However, in the home health world, agencies are often at the mercy of the government programs and insurance companies. So a lot of times they can't really raise the hourly pay by much. The fact of the matter is, regardless of whether payments are increased or not, there will always be individuals who require healthcare services at home. And this number has been constantly increasing since the pandemic. So yeah, it is important to talk about these things and actually not only talk, actually do something about these things. Our team at matchHHa came up with a groundbreaking solution to these limiting payment structures in the home health world. And the solution would have to be groundbreaking and innovative because we can't keep on doing the same things we have been doing in the past and expecting different results. Also, we can't keep waiting for any imaginary savior that is going to come out of nowhere to help us in these situations. We have to be the change that we want to see. So our matchHHa platform is dedicated to giving healthcare workers ownership in their service. The reason why ownership is important is that when you offer a product or service, you are able to let the public decide how much funding you get instead of relying on government or other entities that don't have good track records. As you can see with the recent elections going on, these large entities often have their own interests and don't really care if individuals or small businesses survive or not. So when you rely on the general public, as it should be, based on how good your service is or how appealable you are, people can support you in a way that you will be proud to continue to offer that service. This is what we at matchHHa are striving to bring to the home health world. So I know everyone is wondering, how in the world are you planning to do this? And this is where NFTs come in. By the way, there is a documentary on Hulu called NFTs Enter the Metaverse that is a pretty good explanation of NFTs, how they became popular and how they will shape the future. So I suggest that if you are confused about NFTs or you want to find out more about how they work, you may benefit by starting with that documentary. But yes, I can give a brief overview of what was talked about. It pretty much is a documentary where many leaders in the business, art, and tech industries were interviewed and explaining NFTs and how they work, and they became popular starting from the art world when a graphic artist got millions of dollars for a few of his NFTs. And then that's when everyone started coming out with NFTs, and it led to all of this chaos and scammers and just people who had no business minting NFTs joining the space without a knowledge of what was going on. I'm glad that era died down though, because even I was like, what is this NFT thing? And it makes no sense. But then as I joined the startup tech world, I started hearing how NFTs were pretty much, and cryptocurrency was pretty much going to be the future. And if you want to be a pioneer, now is the time. So that's when I really started researching And I was really amazed at how much a game changer this is going to be for ownership purposes. But anyways, back to the documentary on Hulu. So yeah, it discusses further how, let's start with the art world, for instance. This world was very exclusive, much like a lot of industries we see today. So someone who is a graphic artist who may be really talented in the past didn't have the same access and know-how to take ownership in their work to the point where the public could really fund them and support them for their work. Because how can you really prove a graphic art is an original and one of its kind thing to where it's worth millions? Well, that's where NFTs come in. NFTs stand for non-fungible tokens and are built or coded on what is called a blockchain. So this technology allows digital artists to have a one-of-a-kind piece of art that they own and that they can offer to the public for purchase. The important factors are that they can prove that they own this piece of art throughout the blockchain, and they can also gain royalties on the piece of art every time it's sold. So that is true ownership, and the technology of it all is what changes the game. For years, it has been large entities that take ownership of people's work, whether it's the music industry, large social media platforms, or if we go back to healthcare, you have government and insurance companies. So currently, these large entities control how much people are paid for their work. But should it really be that way? Or should we have decentralized ownership where the public decides how much people are paid for their work? If you believe the public should decide, then you should really consider looking into NFTs, because this is a major key in determining how the ownership will play out in the future. So think of if healthcare workers can get paid based on public support in addition to their hourly salary that they get from their place of work. We envision a world where healthcare workers can take pride in the service that they are providing, which is a very important service. I just read a Forbes article this week that talked about how patients are suffering because there are no nurses working. If there is a staffing shortage at a grocery store or at a restaurant, then the effect would be slow service, dissatisfied customers, staff working double time, etc. If there's staffing shortage in healthcare, there will be all of those things, plus patients getting more infections, increased falls and injuries of the elderly population, individuals stuck at home, unable to move in their bed, nobody to change them when they go to the bathroom on themselves, no one to give them food or water. I've personally seen these situations happen. And this is the reality, which is why I am so passionate about actually doing something about this shortage and implementing our matchHHa incentive program for healthcare workers to have a great home health working experience. So when looking at what's in the media and literature about this topic, I came across this article in Stat News talking about the proposed Medicare cuts to home health and how that can affect the home health world. First, let's see what they say about the benefits of home health. So receiving health services at home is definitely more cost effective than receiving services in a facility. In facilities like hospitals and nursing homes, family members often get charged large amounts of money for their care, which a lot of them can't even afford. Also, when you think of facilities, you have to realize that they are also a business, and the only way they can run is to keep people there. If people aren't in those beds, they don't get the funding. So it's hard to really trust if your loved one needs to be in those facilities or not when you think of those factors. So another benefit from being in home health is the fact that it's just more comfortable for clients and patients to be in their own home. I've seen individuals who I've evaluated and determined that they definitely need to be in a facility, but even these people still prefer to stay at home, even if it means that they don't get the care that they need. So that shows you how much staying at home to receive health services is valuable to this particular community. Another benefit of home health service is that it allows for more independence and faster recovery for people at home. A lot of patients and clients I've talked to mention that they don't like people constantly probing and prodding them because it actually makes them feel more sick. When you are in the comfort of your own home, you automatically feel more empowered to get into a space of wellness. So this is the question that I'm asking, the author of this article is asking, and everyone in the whole home health industry is asking, why then, if there are all of these benefits, why is the funding trying to be cut from home health services by 8%, which according to this article, many agencies are predicted to shut down because of this funding cut? Why is Medi-Cal, which provides healthcare insurance and coverage for services if you qualify within a certain income, why are they not increasing their reimbursement rates to allow home health agencies to be competitive and employ nurses and caregivers who are constantly asking for higher wages? Which is understandable because the cost of living is so high. This Medicare cut is predicted to be billions of dollars in cuts to the millions of people who are receiving home health services through Medicare, which is something that many people have been working for years to receive these benefits through their employment. I'm glad that there is some legislation that was created to address this issue, which is the Preserving Access to Home Health Act of 2022. This measure would suspend the cuts until 2026 so that home health communities can still receive their services while Medicare figures out if these cuts are even necessary in the first place. I mean, the fact that it was found that 90% of seniors would prefer their care at home, that's 90%, that something should be done about this. Oh, and that's just Medicare. Medi-Cal, which is a whole nother story, allows people to receive services with them without paying out of pocket. You would think they would allocate more funds towards this effort. That's actually partly what the Build Back Better Act was about. I don't know if you all remember when this was introduced by Biden last year, but yeah, it was supposed to also help in giving more funding to the home health and home care industries. I am not entirely sure what happened to this act proposal now. Supposedly they altered it into something else. But yeah, all I know is that there has not been an increase to reimbursement rates for nurses and caregivers 2018. This was 4 years ago. But there has definitely been an increase in inflation. There's been increases in pay from other private businesses, which they can afford since they get funding primarily from profits. So you know there's a problem when a nurse contemplates working at, let's say, Target rather than being a nurse because they get paid pretty much the same thing. The sad thing about it is if there are less nurses, if there are less caregivers, it directly correlates to more patients and clients suffering at home. This number will continue to increase, and now let's get into what matchHHa is doing to help change this. For one thing, we have our incentive program, which we talked about earlier, for healthcare workers who solidify their match on our platform. So how it works for you healthcare workers is you register on the app. Then we start with the process of getting you officially processed as an employee of a local home health or home care agency. So once you are officially processed, then you receive access to all local clientele around your area that you can view on the app. There, you can choose a client that matches your preferred schedule and location, and once you request the client or the client requests you, matchHHa will approve. Then your match is officially solidified. Once your match is solidified and you would like to join our incentive program, we will give you access to our NFT platform. You must be on the platform as a healthcare worker in order to receive the benefits of the incentive program. This program is more like a community than anything. And within this community, we strive to offer benefits to home health workers in addition to the benefits you will receive as an actual employee of one of our host agencies. So don't think you won't be protected like some of the other app companies. With us, you will actually be an employee, receive those benefits, and on top of that, as part of the matchHHa community, we will offer a whole lot more. For instance, NFTs for decentralized ownership and funding. Try joining our platform, which we will give you access to a blockchain platform that we are partnering with. On this platform, we are offering each healthcare worker an ability to earn almost double of their regular salary, and this is, of course, based on the support that is received from the community. Remember how I talked earlier about currently we rely on large entities like insurance companies and government programs to determine how much we are paid for our work? But NFTs offer a way to let the public decide how much we are paid. matchHHa is dedicated to minting NFTs for each healthcare worker to allow opportunities for the public to support, as well as join in on the benefits of being a part of the matchHHa community and the benefits we offer. So yes, even if you have absolutely nothing to do with healthcare, you can support a healthcare worker and their service, and you can receive services, perks, and prizes based on how many tokens you buy. Since I specialize in health and wellness, you know I plan on both offering and partnering with people who offer wellness sessions, yoga, food items, courses, also continuing education courses for healthcare workers. We plan on doing community events for networking, volunteering, and giving back. Anything that we feel will contribute to the health and wellness of our communities, we plan on offering. This mission we have is definitely not one-sided. There is so much involved when it comes to bringing more awareness to the home health industry. To this day, home health is barely talked about in the media and not really taught about in schools. So we're hoping with implementing this program, we can bring both awareness and education to the field that we love. That being said, thank you so much for listening to episode 4 of my podcast discussing money moves in the home health world. I hope you all can join me on our mission to provide services to our home health communities in need. Be sure to like and subscribe, which can help get the mission out there and help our communities in need be that much closer to getting the services that they deserve. Again, I have our social media accounts below, as well as the social medias for the matchHHa app, so you can follow up on these platforms, get quick updates, and see our short informational videos. Now that you have reached the end of the episode, you should know that I will always be leaving you off with a mindfulness practice, just because that is my background. I'm a holistic nurse studying to be a yoga teacher, and I just know how important it is to have a mindfulness practice, even if it's just for 5 minutes at a time. It's great for your mental health, just to get your mind centered, whether you want to pray or repeat a mantra or just listen to calming music, or if you just don't want to think of anything at all, These mindful moments tend to help with just being able to tackle the day, remain resilient, and live your best life. And this particular one can help with getting into a creative and innovative space. Okay guys, until next time, enjoy! Alright everyone, thanks for joining me again. Feel free to take a seat wherever you are, or if you prefer to stand or do some stretching or a gentle movement, that's perfectly okay. Let's start by taking a nice, deep, cleansing breath. Try to relax your face, your cheek, muscles, your lips, your jaw. You can close your eyes or leave them open. Forget about any activities you have going on today, activities you have already experienced, anything you have coming up. Just try to be in the here and now. Be aware of your belly and how your belly moves in and out with each breath in and out. Know that that energy surrounding your belly represents a powerful energy that allows you to be you. Know that this power center energy represents all of your will, your determination, your ability to do and create. The fact that you are listening now shows that you have the will to invite wellness into your life. Feel that powerful energy travel up and down and all throughout your body. Imagine that energy propelling you to take risks, be creative, be innovative, invite mistakes, and take them as lessons. And take a deep breath in and breath out. As you release each breath, imagine any shame from mistakes calmly rolling away as you breathe them away. Be aware of your chest rising up and down as you take each breath. Feel the powerful energy at your core and hone in on that energy with every task you do. Know that this powerful energy is always there as long as you acknowledge and access it. You can do anything. As you continue to focus on your breathing in and out, let this powerful energy take hold as you imagine all of the tasks you have, all of the activities, whether it is work, taking care of family members, day-to-day obligations, or even hobbies that you love to do. Know that as long as you feel this powerful energy, you are capable of being innovative and accomplishing anything that you are set to do. Remember that the more you access this powerful energy, the more success you are capable of. Invite that energy with open arms and let that powerful energy take over all of your actions. This energy helps us to realize that we can achieve our goals as long as we continue to acknowledge and access. Take a final deep breath at your own pace. Slowly start to move your hands and feet. Slowly start to be aware of the room and back into your mindful moment with Dr. Franny.